Okay, hello, I'm Dr. David Chorley, and I'm a physician practicing in Bixby, Oklahoma. And today I'd like to talk to you about and give you my take on some of the features and problems with alpha-gal. Now, it's become more public knowledge that alpha-gal is a large concern in the United States. If you look at the distribution geographically, it's roughly from Enid, Oklahoma to the East Coast, from the Gulf to the middle of Iowa, and then up the mild East Coast weather up to Maine. Some studies report it expanding to as far as the Canadian border, but generally when winters get either too dry or too cold, the ticks don't survive. Now, the alpha-gal disease is spread by the Lone Star tick, the female of which is obvious. It's a brown tick with a large white dot on it. The male has a small white dot. And what a lot of people don't know is that the immature form of the tick, the nymph form, which swarms, will also spread the alpha-gal disease. And so we get frequently, well, I wasn't bitten by a tick, but I had chiggers. Probably, not 100% for sure, but probably that was a swarm of the nymph form of the insect. Now, when it bites you, and unlike Lyme disease or Rocky Mountain spotted fever, it doesn't have to adhere for very long. It's a very quick inoculation. Your body then makes an allergic reaction to anything that has been derived from mammalian meat sources. That's beef, lamb, pork, venison, also whale and kangaroo. So from that point on, you can be allergic to just about anything that has some of that content in it. Now, that becomes really, really difficult for people with alpha-gal because there is so much that is derived from animals that you don't think about that is going to potentially set you off with a severe, sometimes anaphylactic, which is life-threatening reaction. I've got a couple of things for show and tell. First thing on show and tell is suitably disguised. This is vitamin D3, vitamin D3 capsules. They're pretty much the same wherever you buy them. They are nicely rich in gold, and you look, that's really healthy for me. Well, vitamin D3, in its majority, is derived from the processing of lamb's wool. Sheep, they wash the wool, and out of the washings of the wool, they collect lanolin, and then they process that, and it becomes vitamin D3. So even though this looks healthy and safe and otherwise beneficial, somebody with alpha-gal allergies could have a really bad allergic reaction on the first time that they took this dietary supplement. If you look at these two different containers, which I brought from home to show and tell, we've got an organic cane sugar. Now, this organic cane sugar does not have a risk for alpha-gal reaction. The cheaper one, the one that you get from the regular supermarket for not much money, is actually filtered through active charcoal, which is the remains of cow bones. Everything is processed in animal production, and cow bones are used to filter water that extracts the pure sugar from mash, so to speak, and then it's crystallized out. So somebody with alpha-gal reactions could have a really bad response to plain sugar, and that goes for anything that you buy that's been used with plain sugar. And as an addition, activated charcoal is in your refrigerator filter, and that refrigerated pure water, which tastes so good, could actually give you an alpha-gal response. So it's a really difficult disease. There's no known cure. There may be sometime in the future a biological response, and we may be able to become immunized against this. I don't know. It's a problem now. There's probably at least 1 million people in the eastern part of the United States who have it. Some of them, the reaction is not terrible, but they feel bad all the time. So what we plan to do at Axis is provide diagnosis if necessary. And the diagnosis can be, well, you go to the allergist and he says your alpha-gal IgE is negative. It's 0. It's really, really small. And then maybe you eat something wrong and you test again and your IgE is over 10 and you go, obviously you have alpha-gal. So we listen to the patient, we examine the patient, we look at other risk factors for the patient to have an adverse reaction to the tick bite. And one of them is a condition called mast cell activation disorder, which means that even before you got the tick bite, you had a predisposition to have severe mast cell responses. I see that a lot in my practice. And then we help you work through what your lifestyle has to do to change, what things you have to avoid. And in the background, there's this major problem. There are a lot of medical supplies, not only medicines themselves, but also things that are prepared for your help in the hospital are animal-derived. And so if you have alpha-gal syndrome, then we will work with you and with specialists and inform them of the seriousness of your disease and help them, should you be in hospital for any particular reason, to minimize the exposure to animal-derived products. It is a lifestyle change. It's an enforced lifestyle change, and it will affect you. There are some people who, through changing their lifestyle, ultimately, one person I can think of over 5 or 7 years of not eating mammal products no longer has severe reactions. That's one thing. There are a number of people who've had a specific kind of acupuncture, and they believe that that has either cured or attenuated their disease. Now, if it works for you, then that's wonderful. But there's no Western scientific basis for the use of acupuncture in the treatment of alpha-gal. But Western science doesn't know everything. So it's fairly expensive, and like everything, it doesn't work on everybody. So I won't discourage desperate people from trying this. All I can say is it doesn't have justification in Western science. However, getting acupuncture in your ear for migraines doesn't either, and there are many people who will give testimony that that's worked for them. So, and that's how I talk to my patients. People they get to a point where they're really desperate, and I understand that. So I thought about going and getting trained for it, and I couldn't in all good conscience charge people $400 for sticking 2 needles in their ear. And that's about what it works out to. So we're working on figuring out how people can survive and thrive with alpha-gal. It's not a simple solution. There are some medicines that reduce your reaction, and I'd be willing to talk to you in person in my office. And when our internet presence is more mature, we'll have some group chats about this. Thanks, guys.